back to The Remedy, brought to you by Coos Health and Wellness. My name is Eric Gleason. Today we are going to discuss healthcare integration, and we're joined today by the Behavioral Health Director of Coos Health and Wellness, David Giels. Thanks for joining us, David.
Thank you, Eric. Good to be here.
So, for those individuals who aren't in the healthcare system or in the know, what is healthcare integration?
We used to be in a position where we split off our bodies and our minds into separate entities. So we would get one kind of treatment over at our doctor's office. If we needed mental health, we'd go to another area, another provider. And when we if we had a problem with alcohol or substances, we'd go to a third provider. So it's really trying to bring all these different aspects of healthcare back into one fold and to really work together. It's about creating a healthcare team that treats us as a whole individual, as a whole person. So that's not a new concept, but it's something that we're remembering, and it's really about delivering more effective care that has better outcomes for all of us.
It's more of like a one-stop shopping approach for the consumer itself.
It is, part of it is a one-stop shop, yes. So, I mean, one area you would look at see this is if you go to your primary care office, you may find that they want you to meet with a behavioral consultant, and that's new. That's not maybe something that existed. And when you go to your primary care doctor, they might ask you things about your mental and emotional condition. They might do a screening. You might take a survey about your alcohol use and your tobacco use. And so that's one of the areas that you might commonly start to see that impact in your life.
All right, so what does this new approach mean for those that you guys serve?
So for those at Coos Health and Wellness, we've been primarily working with people with mental health considerations and concerns. And so we've already started to ask a lot of questions of individuals and inquire about things like their health conditions, diabetes, COPD, chronic conditions, alcohol use, substance use. But the new part of this program that we're now going to do is by having some level of primary care services embedded in our clinic so that people have access to primary care within our organization. And it's really designed for working with people that may not be as effectively treated in primary care settings. A lot of the folks that we see have not seen a primary care physician in 5 years or longer. Some of them have a lot of significant mental health conditions that have also significant diabetes that's been out of control, not managed. Wow. So the idea is really to try to quickly be able to address any kind of physical consideration that we've noticed.
Sure, that makes sense. Who's involved other than you guys in this project?
Our main partner is North Bend Medical Center. We've been very excited to partner with them. They're very excited as well. They have good experience opening up clinics and extensions of clinics in other areas. I think they're in many of our communities here, both in Coos and in Curry County. So they have good experience doing this, and there are a provider and a nurse in particular that are very excited to work with our group. And what we're going to be doing is a little bit unique. I mean, most primary care visits, if you go, I mean, you're looking at maybe a 15-minute visit. We're looking at initially a 45-minute visit.
Oh, okay.
So we'll take a little bit more time.
All right.
Some of the folks we work with need a little bit extra time.
Sure.
Some of them have a hard time communicating exactly what's going on, and so maybe a little bit of hand-holding. We're also looking at having a mental health case manager, somebody that already knows them and is working with them, come to their appointments and be able to advocate and speak a little bit for them as well. So
when's this going to start?
The start date is October 1st. If we can get everything together at that point.
Sure.
And we're starting small. We're looking at probably a day a week of primary care services to get us going and get us a little bit of experience with a mode to really expand that to at least a part-time, a half-time presence of primary care physician.
That's great. So if you have any questions regarding Coos Health and Wellness's new project, you can get a hold of their Healthcare Integration and Promotion Director at 541-266-6741. And for the Remedy and Coos Health and Wellness, thanks for joining us.